Hello, my name is Hung-Rong Yen from China Medical University, Taichung, Taiwan. I'm currently serving as a professor and dean of the College of Chinese Medicine, as well as the director of the integration of Chinese medicine and Western medicine in China Medical University and Hospital in Taiwan. So today I'm going to talk about the integration of traditional Chinese medicine into clinical health care. So this is the outline of my presentation. I will introduce to you about the pros and cons of TCM and Western medicine, and what kind of diseases are suitable for integrated therapies. Then I will also tell you about some evidences that support integrated therapies, and then followed by sharing with our experiences of integrated therapies in Taiwan. So at this moment, we have the TCM consultations during the hospitalization, and also we have some joint TCM and Western clinic in our university hospital. So first, I would like to introduce to you about the pros and cons of traditional Chinese medicine and Western medicine. So Western medicine usually treats the patient on a disease-based diagnosis. And the treatment is targeting some kind of molecules, receptors, or pathway of the disease or the disease mechanism. And the diagnosis usually is very precise based on the hematologic, biochemical, laboratory investigations, or the image study such as X-ray, MRI, and so on. And there is a standardized treatment protocols. So which means as long as the patient has some kind of disease, the treatment will be based on a protocol that is used to standardize all of the treatment. And there is also a regular follow-up suggestions for those patients who recover or who recover from the disease. And then for those patients who didn't suffer from the disease, they will also need to receive a preventive medicine like a health examination checkup to make sure that they do not have the recurrence or the occurrence of a certain kind of a disease. And traditional Chinese medicine use this kind of approach that we call it a syndrome differentiation, which is a combination of the 4 examinations, including inspection, smelling and listening, inquiry, and the palpation, to diagnose a patient. So not only the 4 examination, it also have to consider about the environmental factor, climacteric factor, and also some of the social environment and internal environment and so on. So based on the body constitution and the 4 examination and all of the factors combined together, a TCM doctor can make that diagnosis of the patient, and which is called a syndrome differentiation. So very often you can hear that a TCM doctor say that the patient has a Qi deficiency and like some kind of heat or some kind of a cold evil. So then the treatment is based on this kind of syndrome. So every patient, although they have a same disease, they might have different syndrome. So that's why we say that this kind of treatment is also individualized. For example, an elder patient with hypertension and a young adult with hypertension, although they suffer from the same disease, which is hypertension, but they will have a different syndrome. The elder one might not have the Qi deficiency. However, the adult one might have too much heat. So you have to treat the patient with the individualized protocol and herbal medicine or acupuncture treatment to treat the specific syndrome, or we call it a pattern in TCM. And because the examinations or the diagnosis is based on the 4 examinations, it's not like the pathological diagnosis or the biochemical diagnosis. So you won't see a very detailed quantitative measurement of the changes of the biochemical profile of the patient. But you see really the dynamic change of the qi and blood and so on. So this kind of a diagnosis is called the combination of the 4 examination. And a TCM doctor also emphasize the body constitution. So different persons will have different body constitutions. The treatment need to be adjusted according to the different body constitution. And a TCM doctor also emphasize health promotion. So the diet, the lifestyle, and Qigong exercise and so on are also very important for the health promotion from the perspective of traditional Chinese medicine. So which one is better? There is actually no absolute answer. So for a healthy patient, it might be very important to emphasize the preventive medicine or the health promotion in traditional Chinese medicine. And then for a diseased patient, in Western medicine, it emphasizes the standardized treatment protocol with regular follow-up, while in traditional Chinese medicine, we treat the patient with some specific or individualized protocol for each individual patient with the different body constitution. Then for the patient who were cured or who recovered from the disease, you still need to prevent the recurrence or metastasis of the disease. So I think both TCM and Western medicines emphasize the preventive medicine and health promotion. And when the patient has a disease, Western medicine usually has a more precise diagnosis, while the TCM treatment emphasizes the individualized treatment, which might be also better for the treatment of the different kind of syndrome. Then because TCM doctor not only treat the disease, but also all of the symptoms which is composed of the syndrome or a pattern of the patient. So there might be a more holistic and overall considerations for the treatment of the patients instead of just only treating the disease. But I think there is no definite answer. The best way is to combine Western medicine and traditional Chinese medicine together. For a certain kind of disease, maybe Western medicine has some advantage. For certain kind of disease or conditions, TCM might have a better advantage for the patients. So it might be better that we can combine both of them together for the best treatment of the patients. So I often say that there is only one patient. We should not differentiate medical treatment into Western or traditional Chinese medicine treatment. If we can find a combination or the integration of both is better for the patient, then we should treat the only one patient with the integration of Western and traditional Chinese medicine together. So a couple years ago, the National Center for Complementary and Integrative Medicine, which was originally called the National Center for Complementary and Alternative Medicine, it changed the name because we should not regard the complementary medicine as alternative. We should try to integrate it into the healthcare of the patients. So by doing this, complementary medicine is no longer alternative and is part of the treatment. So that's also corresponded to what I just told you. There is only one patient. We should regard the health of the patient as one thing that we should integrate. Anything that could be beneficial for the patients, for the best treatment of the patient. So what kind of diseases are suitable for integrated therapies? I will take a couple examples in the following slides to show you that some of acute illness or some of the chronic illness could be suitable candidates for the integrated therapies. So in Taiwan, our previous study showed that there were about 31.2% of Taiwanese people are using traditional Chinese medicine. So here you can see that most of the TCM users are female, and they reside in a highly urbanized area such as the northern area and also the central area. We also did a study to understand how many children are using traditional Chinese medicine. So here you can see 22% of children in Taiwan are using traditional Chinese medicine. And most of them reside in the northern and the central part of Taiwan. So compared to the Western medicine, it seems that not so many children are using Chinese medicine, but remember that they will grow up. If they receive a TCM treatment when they were young, it's also very likely that in the long term, when they grow up, they will also use a traditional Chinese medicine. And we also did this analysis showing that even the elder patient, they will also use a traditional Chinese medicine treatment. So here you can see among the elderly population more than 65 years old, 26% of Taiwanese people are using traditional Chinese medicine for their treatment. And most of them also reside in highly urbanized areas such as the northern and the central part of Taiwan. If we further take a look at the acupuncture utilization in Taiwan, so the National Health Insurance Program was implemented in 1995. Ever since 1996, traditional Chinese medicine is also included in the reimbursement of this National Health Insurance Program. So here you can see that until 2011, 1 in 10 Taiwanese adults are using acupuncture treatment, and many of them reside in a highly urbanized area, which is the level 1 urbanization area in Taiwan. So there are a couple different kinds of major systemic illness that integration of traditional Chinese medicine might provide a benefit for the patients. This is according to my observation and also some of the evidences from the past research. So here you can see that Chinese medicine has some advantage in immune-related disorders, in endocrine and metabolism-related diseases, and also some of the neuropsychiatric disorders. For example, for those patients who suffer from allergic disorders such as allergic rhinitis, asthma, and atopic dermatitis, eczema, Chinese herbal medicine or acupuncture treatment might be beneficial for these patients. And for those patients who suffer from autoimmune disease or chronic inflammation, Chinese herbal medicine and Chinese medicine treatment might also provide some benefit for these patients. And for the cancer treatment, there is also a beneficial effect when combined the Chinese medicine treatment with the conventional Western medicine treatment. And even for the infections such as the COVID-19, you can see that although vaccines can provide some protections from the COVID-19 SARS-CoV-2 infection, Chinese herbal medicine might also help those patients to recover faster compared to those who didn't receive the Chinese herbal medicine, and it can also provide some beneficial efficacy for those patients who suffer from the long COVID symptoms. And for the endocrine and the metabolism related disorders, we know that Taiwanese people like to receive the postpartum care with the Chinese medicine, such as medicinal cuisine, such as trainer massage, and even some of the Chinese herbal medicine treatment for different kind of postpartum discomforts. And even for some of the women who suffer from the menstrual disorders, or those who have the hormone disorders, or for those adolescents who have the period that comes in their early age, and also for those women who suffer from the menopausal disorders. And for those who have the dysregulation of the hormone or some of the metabolic disorders, such as hyperthyroidism due to the autoimmune thyroiditis, or different kind of disorders such as diabetes and hyperlipidemia, some of the Chinese herbal medicine can help to lower the blood sugar or to lower the cholesterol and triglyceride. So Chinese herbal medicine might also be beneficial for those patients who have these endocrine and metabolic disorders. And for those who have the neuropsychiatric disorders, such as stroke, which is a cerebrovascular accidents, acupuncture treatment can help those patients to recover, to rehabilitate their conditions better. And for those who have a dementia, degeneration, or aging related disorders, Chinese medicine or acupuncture treatment can also help. And especially for those who have the musculoskeletal disorders, such as ankle sprain or HIVD, before they receive any kind of orthopedic treatment, Chinese medicine treatment, including the Chinese traumatology treatment or acupuncture treatment, can help these patients as well. And for those who suffer from the mood disorders, such as anxiety, depression, traditional Chinese medicine can also help these patients. So I think the best way for the treatment of the patient is try to integrate Chinese medicine and the Western medicine together. By doing this, it can help to enhance the efficacy, alleviate the side effects, and also reduce the sequelae. So think about this. For a healthy patient, for a healthy individual, usually in Western medicine, he or she will receive the health checks regularly. And in TCM, we emphasize that we need to have the TCM health promotion. And then when they were diagnosed with some kind of disease in Western medicine, which is in Western medicine, it quite often emphasizes the early diagnosis of the disease. The patient might suffer from some kind of a condition that we call the sub-health condition. Might be very mild disease or some of the symptoms, but even some of the diagnostic method in Western medicine cannot diagnose the patient. And at this moment, the patient might have some of the subtle changes that will also change the body constitution. So in TCM, we try to do the body constitution conditioning to condition help to nurture the body constitution of the patient. Then finally, if the patient is diagnosed as a certain type of disease, in Western medicine, there are different kinds of disease-specific treatments, such as chemotherapy, drug, or like a surgery, or some of the target therapies, targeting the receptor molecules or pathways related to the disease. And in TCM, we do the 4 examinations, combining the factors of the body constitution. Eventually, the patient will have a syndrome differentiation diagnosis. So the patient will be diagnosed as a certain type of syndrome. Then TCM doctor will use the acupuncture, massibustion, Chinese herbal medicine, trainer massage, and other Chinese medical treatment approaches to treat the patient. When the patient recovered from the disease, the patient usually often worry about the recurrence of the disease. So in Western medicine, there will be some rehabilitation program for the patients, and for traditional Chinese medicine doctors, we will try to recuperate the patients from the disease, the illness. And then finally, if the patient fully recovered from the disease, the patient still need to receive the health checks. And in TCM, we emphasize the health promotion by using the Qigong exercise, medicinal cuisine, diet, and also the lifestyle modification to prevent the recurrence of the diseases. So you can see that both these two kinds of medicines use very similar approaches, try to enhance the efficacy, try to minimize the side effects, try to reduce the sequelae. And if we can combine the strengths of both two different medical systems together, then we might be able to provide the best treatment for the patients. So here I'm showing you a couple evidences that support integrated therapies. So the first one, I will introduce to you about treatment for dermatological disorders. So this is how we treat the patients with psoriasis in our clinic. So psoriasis is a kind of chronic inflammatory autoimmune dermatological disease. 90% of the psoriasis patients need to apply topical steroid ointment. So our research team in CMU and the CMU hospital found that topical application of a Qingdai, or we call it indigo naturalis, or in Latin name, this kind of a Qingdai ointment could ameliorate the clinical severity of mild to moderate psoriasis through the inhibition of interleukin-17. So this is a kind of treatment originally documented in ancient Chinese herbal classics. So it was originally said to treat those patients who have the worms, toxin, and rashes and skin rashes. So we first used this big data analysis in our National Health Insurance Research Database, and we showed that among the patients with psoriasis, many of the TCM doctors will prescribe Qingdai for treatment of the patients with psoriasis. Then a couple years ago, working together with my colleagues, we also identified that this kind of a Qingdai treatment can help to totally improve the skin conditions in a child who suffer from psoriasis by using this topical application of the Qingdai ointment. And here you can also see that before and after treatment in a clinical trial conducted in our university hospital, the Qingdai ointment treatment can improve 56.3% of the PSI 75 in these adults with psoriasis. And further mechanistic studies show that the Qingdai treatment can reverse the interleukin-17 gene and pathway related molecules after the treatment. Here you can also see on the right-hand side that after 8 weeks of treatment, Qingdai ointment can improve the psoriasis in these patients. And also, we did this study in a stroke patient. We identified the herbal medicines used in patients with stroke in Taiwan. And among the stroke patients who additionally receive TCM treatment, which means that they not only receive the regular standardized Western medical treatment and rehabilitation, they also received complementary TCM treatment. And the integration of the TCM treatment can reduce 56% of mortality risk in a stroke patient. Here you can see that not only those patients who suffer from ischemic stroke, but also those who suffer from hemorrhagic stroke, they will have a reduced risk of mortality when they receive the complementary traditional Chinese medicine treatment. And you can also see that in one of the studies that we published a couple years ago, showing that the integration of traditional Chinese medicine can reduce 31% mortality risk among the cancer patients. And our colleague in Taiwan also showed that even for those patients with chronic kidney disease, the prescribed Chinese herbal medicine can have a survival benefit for those patients who have the end-stage renal disease. So here you can see that the overall mortality of this patient were largely reduced when they received the complementary Chinese herbal medicine treatment, and also if they receive the complementary Chinese herbal medicine treatment, they will also have a reduced risk of the end-stage renal disease. So this was published a couple years ago in Kidney International. And some of you might also have ever heard about this study published in New England Journal of Medicine, that Tai Chi can improve the postural stability in patients with Parkinson's disease. So we know that for those patients who have the Parkinson's disease, they usually have a very high risk of falling down because of the postural stability problem. And Tai Chi is a kind of a Qi Gong that is quite often practiced and also introduced by traditional Chinese medicine doctor, can improve the postural stability in these patients. So after receiving the Tai Chi practice exercise for 6 months, they have a better posture control. They will have a more better directional control as well. And we also conducted study by using the big data here in Taiwan. We show that the complementary Chinese herbal medicine treatment can reduce the 50% risk of fracture in those Parkinson's disease patients. So in this long-term follow-up up to 10 years, you can see that complementary Chinese herbal medicine treatment has a protective effect to protect these patients from falling down or the risk of fracture. And even more, complementary Chinese medicine treatment can reduce the 44% risk of stroke in the Parkinson's disease patients. So you can see that in this long-term 10-year follow-up, they have a lower cumulative incidence of stroke. And for fibromyalgia patients, they usually suffer from the pain in multiple joints in the whole body, and the quality of life is also largely reduced. So Tai Chi practice can improve the quality of life among these fibromyalgia patients. So this was a study conducted by a research group in Boston, and they showed that in this fibromyalgia patient, when they measure the fibromyalgia impact questionnaire, you can see that Tai Chi practice can help this patient to have a better quality of life. And not only Tai Chi practice, acupuncture treatment can also help to reduce pain in fibromyalgia patients. So here you can see in another study conducted in Mayo Clinic, for those patients who suffer from fibromyalgia, when acupuncture were applied to different acupoints in the patients, you can see that after application of acupuncture treatment, acupuncture can reduce pain in those patients who suffer from fibromyalgia. So they have a better quality of life. You can see from this fibromyalgia impact questionnaire, they have a lower total scores. And not only the chronic illness and the chronic pain, acupuncture can also help to relieve pain in the emergency room. So this was a study published in American Journal of Emergency Medicine. So here you can see that compared with the morphine. So morphine usually can help to reduce pain quite quickly. So the time to 50% reduction of pain by using morphine treatment was about 28 minutes for those patients who suffer from the acute pain in the emergency room, while acupuncture can almost immediately relieve the pain at about 16 minutes. So here you can see that both groups is composed of 150 patients, and acupuncture has a better improvement in the pain scores in these patients. And earlier, there was also a study published in JAMA. So this is a study showing that electroacupuncture can improve stress urinary incontinence. So here you can see these are the acupoints that TCM doctor applied to treat those women with the stress urinary incontinence. And electroacupuncture can significantly improve the urinary incontinence compared to the sham electroacupuncture treatment. And then in another study published in JAMA Oncology, here you can see that in this meta-analysis and systematic review, acupuncture and acupressure can relieve cancer pain in these patients. So here you see that the result of the meta-analysis showed that the acupuncture or acupressure is favorable to relieve the cancer pain. And even for those patients who suffer from chronic stable angina, in a recent study published in JAMA Internal Medicine, you can see that acupuncture as an adjunctive therapy can help those patients who have chronic stable angina to relieve the angina attack better than the other treatment. And we also conducted this study a couple years ago showing that acupuncture can reduce 57% risk of chronic heart disease in fibromyalgia patients. So here you can see that in the long-term 10-year follow-up, acupuncture treatment can reduce this kind of heart attack in fibromyalgia patients. So this is according to a previous study showing that fibromyalgia patients usually are more depressive or anxious, and they also suffer from some chronic inflammatory diseases in their in these patients, and then heart attack or stroke are quite often in these patients. So we show that combined with the acupuncture treatment can reduce the chronic heart disease risk in these patients. And in a study published in Journal of Clinical Oncology, it was also shown that acupuncture can alleviate the hormone therapy associated side effects. So we know that this kind of hormone therapy, the so-called aromatase inhibitor, can inhibit the hormone quite well in breast cancer patients. However, this kind of aromatase inhibitor can also be associated with the joint symptoms in women with early stage breast cancer. So acupuncture treatment can significantly reduce the joint pain in these patients. And we also published this paper in Journal Affective Disorders showing that acupuncture can reduce 51% risk of stroke in the depression patients. So here you can see in a long-term 10-year follow-up, those patients who received the integrated therapies with the acupuncture treatment, they have reduced the inflammation, and therefore the risk of stroke is being largely reduced in these patients. And in Taiwan, we have some experiences of integrated therapies. So I'm showing you some of the experiences here in Taiwan. First, I will introduce to you about the TCM consultations during the hospitalization. Next, I will introduce to you the joint TCM and Western medicine clinic. So let's take a look at this patient in our clinic first. This is a case of diabetes for more than 15 years. So the patient is now on oral hypoglycemic agents and other medications with glycated hemoglobin at about 7 to 9, which means the patient is not controlled very well. And the patient also had a foamy urine and numbness of extremity, easy to be angry, fatigue in the afternoon. So he came to the TCM clinic for help. And upon taking the pulse, we found that the pulse is kind of slippery and rapid, but sluggish at deep location. And the tongue was shown here in this picture. You can see that the tongue color is quite a dark red. It's not like the kind of pink. This means that they might have some stagnation of the blood. This means the circulation of the patient is not so good. And you can also see that the tongue coating is kind of thick, and it's kind of white and yellowish. So this means the patient might have some dampness, including the heat in this patient. So heat could be due to the inflammation in the patients. So in Western medicine, you can see that from the macroscopic view, you will see that the patient will have the macrovascular complications such as stroke, heart disease, and peripheral vascular diseases. And from a microscopic perspective, the patient might also suffer from diabetes retinopathy, diabetic nephropathy, as well as the neuropathy because of the accumulation of this glucose in the local regions. Especially diabetes nephropathy is now occurring in the patient, so the patient has the foamy urine, and the patient also complained about numbness of the extremities, which could be the diabetes neuropathy. And for the long term, the patient have a higher risk of a stroke and heart disease, as well as the poor circulation of the vessels. So from the perspective of TCM, the patient has a phlegm damp, the dampness, and also the qi depression, and also might be because of the yin deficiency. Then the patient will have the blood stasis, and all of these can also transform into heat. So you will see that for these diabetes patients, they usually have the phlegm and the static blood, and also both these two conditions can combine together. Sometimes the patient might also have a damp heat or phlegm heat. They also will have the depressed qi, and this will make them to feel fatigue, And this kind of depressed qi might also transform into fire. And some of the diabetes patients are quite thin, and when they have this kind of yin vacuity, very often they will also have the internal heat or inflammation. So you see that flame and stasis are two major pathomechanisms from perspective of TCM. And then in the late stage, they will have a dual vacuity of qi and yin. They will have a dual vacuity of yin and yang. And they will have the vacuity of qi, blood, yin and yang. So this actually corresponds to the Western medicine's perspective. So here you can see that from the macrovasculopathy point of view, the patient who is on the hypoglycemic agent, so all of these diet, sugar, protein, fat, they can influence the blood sugar, and so you need to cool the blood heat. You need to disperse the stasis. And then in the later stage, from the microscopic view, when the patient suffers from the microvasculopathy, such as the influence on the kidney, or the eyes, or neuropathy, you need to nourish the spleen and the kidney. You need to warm the yen and disinhibit dampness, and also need to warm and transform the flame damp to reduce the lipid and metabolites that are harmful to the patients, and to drain and disinhibit the gallbladders to drain the metabolites or lipid-soluble metabolites that are harmful to the patients. So there are a couple considerations for the TCM treatments in this patient. Here you see that you have to consider the disease stage, whether if the patient is receiving insulin or not, whether if the patient has high blood sugar or not, whether if the condition is stable or not, and if there is any complications, microvascular or macrovascular, and also any other discomforts. So what we can do is, first, you might want to consider to delay the use of insulin. You also might want to minimize the drug use and the fluctuation of blood sugar, and also try to control the disease complication, try to decrease the complications, and then maybe try to improve the quality of life, to improve the symptoms of the patients. So we did this study a couple years ago. So we collect 1 million individual samples from the National Health Insurance Research Database. So in this research database, we identified 33,000 patients who were newly diagnosed as the type 2 diabetes with the anti-diabetic agents. So among them, some of them are not TCM users, which we define them as those who didn't receive TCM treatment or who only received TCM treatment for fewer than 30 days. We also identify those patients who received TCM treatment for more than 30 days. And then using a 1 to 4 frequency matching with the gender, age, comorbidity, and diabetes years, we will finally be able to identify 1,049 TCM users compared with 4,092 non-TCM users. So here you can see that at baseline, both these two groups are quite similar in their age, comorbidity, and anti-diabetic agent utilization. So we identified that there are some common single herbs prescribed for diabetes patients with or without insulin treatment. For example, here you can see that dansen or 天花粉, 黄芪, 山药, 葛根, 石斛, 玄参, 麦门冬, 苍竹, and 大黄 were quite often prescribed for the patients who have diabetes. Even though for those who are receiving insulin treatment, you can see that this kind of utilization are also quite often for these patients. And then we also identify some of the Chinese herbal formulas prescribed for diabetes patients with or without insulin treatment. So you can see that 六味地黄丸, which is LWDHW. So, and also some of the derivatives from the LWDHW, the 六味地黄丸, are also quite often prescribed for the patient who suffer from diabetes, like 栀博地黄丸, 寄生肾气丸, 杞菊地黄丸, and 八味地黄丸. And in addition to the 六味地黄丸 and its derivatives, there are also some other Chinese herbal formulas being prescribed for these patients, such as 白虎加人参汤, 玉泉丸, 白虎汤, 甘露饮, and 血府逐瘀汤. So finally, we try to understand if the integration of TCM treatment can provide some benefit for these type 2 diabetes patients. So we compared those patients who received TCM treatment with and those patients who didn't receive TCM treatment. And we found that those patients who received complementary TCM treatment will have a protective effect from the stroke attack. So here you can see that the integration of TCM treatment can reduce 33% of the stroke risk in the type 2 diabetes patients. And not only the chronic illness such as diabetes, in Taiwan nowadays our national health insurance program are providing the complementary or integrated TCM treatment for patients with different kind of illnesses, including those patients who have an acute illness in the emergency room. So those patients who have 9 indications in the emergency room, they can receive the acupuncture treatment. So these are the 9 indications: dizziness, vertigo, acute abdominal pain, ileus, chest tightness, pain, palpitation, soft tissue tenderness, menstrual pain, migraine, cancer pain, musculoskeletal system related pain, and stroke. So this is one of the TV news introducing that in Taiwan we have this hospital is Changhua Christian Hospital. They combined TCM treatment for those patients who suffer from acute illness. And for those patients who suffer from stroke, head injury, and spinal injury, within the 6 months of the diagnosis, whenever they were admitted into our inpatient department, they can receive the complementary TCM treatment for a better recovery. And even 2 years within the diagnosis, in our outpatient department, there will be a special program to provide some of the integrated treatment for these patients. And for patients who suffer from catastrophic illness such as cancer, they will not need to pay the copayment when they see a Western medical doctor or traditional Chinese medical doctor in Taiwan under the health insurance program. So for their health care in the inpatient or outpatient department to ameliorate the discomfort and side effect after surgery, chemotherapy, and radiotherapy, they can consult TCM doctor to improve the quality of life, to improve the cachexia-related weight loss, poor appetite, cancer-related fatigue, and cancer pain. So this will make the patient to live a better life even though the patient suffers from cancer. So this is one of the news report about a colon cancer patient who received the integrated cancer therapies with the help of our colorectal surgeon and also TCM doctor in our university hospital. And for those patients who suffer from chronic kidney disease, nowadays we also have an integrated treatment protocol for patients with CKD. So for patients who suffer from stage 2 to stage 5 chronic kidney disease, they can consult TCM treatment, and this will include Chinese herbal medicine, acupuncture, acupressure, and TCM doctor will also provide some health education, including the diet, lifestyle modification, and our TCM doctor or Western medical doctor can also help to evaluate the renal function of the patient. So this is also providing some benefit for the patients. And the reason for our health insurance program to reimburse this treatment is based on some of the previous studies showing that there are a couple advantages of the integration of Chinese herbal medicine treatment for patients with CKD, such as the reduction of the risk of end-stage renal disease, the reduction of mortality risk, the improvement of proteinuria and edema, the improvement of anemia, pruritus, quality of sleep, and also quality of life. It can also ameliorate pain symptoms in these patients. So in the past few years, I also worked together with our nephrologist to provide integrative therapies for CKD patients in our university hospital, combine the strengths of Chinese herbal medicine, acupuncture, acupressure, TCM lifestyle modification, and the syndrome differentiation. Our nephrologist, which you can see is in the middle of this picture, work together with me on the left-hand side and also our TCM doctor to see the same patient in the inpatient department. And nowadays, we also provide this kind of home-based medical integration program. So this home-based medical integration program includes 3 stages of care: the home-based medical care, the severe home-based medical care, and hospice care. So for patients who live at home and have medical needs assessed by a care team, and who are unable to go out for medical treatment due to incapacity or disease characteristics, they can consult TCM doctor to go to their house, to go to their home to see the patient to give the treatment on site. And even for women with infertility and for men with infertility, we also have the program to help the couples to increase the fertilization rate to prevent spontaneous abortion in those pregnant women. So the infertility protocol is used for male or female, and for those women with spontaneous abortion history, they can also consult TCM treatment to prevent further spontaneous abortion when they got pregnant. Like for example, here you can see that one of our TCM doctor gave a treatment to the women, and the women got pregnant even though she's 39 years old. And for children, we also provide integrated pediatric care. Nowadays, the National Health Insurance Program provides reimbursement for those children who suffer from asthma, cerebral palsy, and allergic rhinitis. They can come to see a TCM doctor under the referral of Western medical doctors or the enrollment from the TCM department. After they have the diagnosis from the Western medical department, they can come to TCM department to receive the combinational treatment with herbal medicine, acupuncture, acupressure, and also herbal plasters. And they will also receive the regular follow-up with the pulmonary function and some blood tests to make sure that their disease is under control. And here you can see a couple examples in our university hospital. We have integrated or joint TCM and Western medicine clinic in our university hospital. On the left-hand side, you can see we provide the integrative treatment for those children who have the growth and development problem, and this was also earlier was also certified as and awarded with this symbol of national quality. And we also provide health care for the respiratory disorders with the combination of the TCM examination, Chinese herbs, and also Western medical examinations. And for dermatological disorders, we also have the integrated therapy for those children who have the skin disorders with the help of the dermatologist and TCM doctor here in our university hospital. So now I'm going to show you one of the video, which is was filmed by our Ministry of Health and Welfare. So it is a video introducing how we integrate traditional Chinese medicine and Western medicine in our university hospital.
然后我就觉得小孩子还是不要让他接触西药太多，所以我就往中医这边寻求。害怕他长不高，因为他的骨龄其实比一般小朋友大了2岁。
望闻问切，辨证论治，所以这样对一个疾病有一个整体的一个观念。中医讲究的是全人的观念，那西医在诊断上面相当的明确，治疗上面也有很多对抗的治疗，但是中医其实很擅长一些调理调补的方式。
然后我就觉得小孩子还是不要让他接触西药太多，所以我就往
西就大家所知的，除了从身体测量，然后甚至可以做一些实验室诊断，甚至包括一些影像学，那其实都是很科学化的证据。
像我们今天看到的这种儿童的生长发育，它可能西医以诊断为主，那中医以用药为主，两个可以相辅相成。
你全面的缺乏不是西药可以单纯这样子去补充完的，所以你用中药的食补方式很均衡的饮食。西就大家所知的，除了从身体测量，
像异位性皮肤炎这一类型比较慢性反复性的疾病上面，我们就会觉得有的时候还是有一些不足够的地方。在西医的部分我们会先确立诊断。那中医的部分的话，事实上在慢性反复的过程中，他们有一些方法可以让小朋友一样可以稳定下来，那减少一些类固醇的使用量。
所以病人来的时候，会有同时一个中医师、一个西医师，在隔壁的诊间或在相同的诊间一起看这样的病患。
那这个过程中，我们可能会发现，彼此有怎么样的一些方式可以互相这个互补合作啦。
在西医的部分我们会先确立诊断。那中医的部分的话，事实上在身高都一直在持续的稳定在成长，然后我觉得这个是我最大的欣慰。
期待吧，就是这种3管齐下、双管齐下，就可以让你家女儿的这种状况可以赶快的改善。
在隔壁的诊间或在相同的诊间一起看这样的病患。
那这个过程中，我们可能会发现，彼此有怎么样的一些方式可以互相这个互补合作啦。身高都一直在持续的稳定在成长，然后我觉得这个是我最大的欣慰。
期待啦，就是这样3管齐下、双管齐下，就可以让你家女儿的这种状况可以赶快的改善。
Okay, so I will stop here. I hope you have more understanding about the benefits of the integration of traditional Chinese medicine and Western medicine for the same patient. And also, I hope you also learn from some of the evidences that not only acupuncture but also Chinese herbal medicine and other Chinese medical treatments such as Tai Chi, Qigong exercise can also provide some benefits to the patients. And finally, I share with you some of the examples here in Taiwan and also our university hospital. This can also provide some implications for your future clinical care. Thank you very much.